Hi everyone, we'll start formally in just a moment. We're just waiting for the last few folks to join. Welcome everyone. Let's start our webinar now. I'd like to give you all a very warm welcome from us here at Consumers Health Forum. My name's Elizabeth Deveny. I'm the CEO of Consumers Health Forum, and on behalf of myself and my team who've been working terrifically hard over the last day or so to get everything ready for this webinar today, a warm welcome. I'd also like to begin by acknowledging that I'm on Ngunnawal and Ngambri country today, and wherever you are, I'm sure you join me in paying respects to elders past, present and emerging. I'd also like to extend a special warm welcome to any First Nations people who are joining us on our webinar today. So here's the outline of the presentation today. We'll talk a little bit about how we got to our budget submission, bit about the budget overall, the health budget, what others have said, what we think are the highlights and the lowlights, and where to from here. So we'll be taking questions. So we really encourage you to put your questions into the chat. What we love to see is if everyone puts in which member organisation they're from. If you know what country you're on, it's lovely to know where you are from all around Australia. We also I just want to again acknowledge our members for being here today and let you know that there are a few slides, but we will send a link out to you with this webinar so that you'll be able to look at it at your leisure. So if there's any information in here and you don't catch it today, don't worry, we will send a link to the webinar out. Our members are incredibly important to CHF as a peak body. Being able to hear from our members, get the different perspectives that our members bring to us about the needs of communities and consumers really helps us in understanding the questions we should be asking or the things that we should put forward to government. So a huge thanks to you for all the work that you do, and also a thank you for giving us the opportunity to learn from you. We really appreciate that. I did notice when I was looking at the list of participants, we did have a few people on the list today who are not our members, and this is a members only forum today. I'd encourage you, if you are interested in our work, then a way to come to member functions will be to join as a member. So I really encourage you all, if you're not members, to join CHF as a member. So let's have a look at what this budget has provided, and particularly what consumers wanted. So over the last year or so, particularly, we've been hearing from consumers about a wide range of policy areas. We've recently been analysing a lot of that work to try and understand if there are any key themes that come out across, whether we're talking about after hours care, medicines, digital health, what are the things that people really want to see? And this is it, what you can see in front of you. These are the things that Australians told us they really wanted to see reflected in the budget. These are the things that are most important to them in terms of managing their healthcare. So we used this as part of the information that we used to develop our budget submission. The other thing we did, and again, thank you to all of you that were involved as we reached out to our organisational members and asked them what it was that they wanted to see in our budget submission, and got information from you as well. So our budget submission came partly from the many, many stories we'd heard from health consumers, as well as directly reaching out to our member organisations and asking them what is it that they think is important for them and their membership. So that group effort led us to the measures that we have in our budget submission. And these particularly here that you can see on the screen, these are the things that we asked for and that in some way, shape or form have actually been included in the budget. So we're really delighted to see that some of those issues that were so important to Australians have been covered off in this budget last night. Health equity, of course, is super important to CHF, as it is to many of you. And a lot of what was in our budget, the underlying assumption is that we want to see better equity, particularly in relation to people's access to healthcare. Some of what we wanted in our submission didn't get up, of course, but the government has done other things to try and improve health equity. And so we're modest enough to say we might not always have the best ideas, and we're really open to see what the government's doing to try and improve health equity. And we'll be very keen to see how some of these measures roll out. So let's just stop for a moment and think overall about the budget rather than particularly about health. Many of you will have heard the conversation that's been live for the last couple of years about, last couple of weeks, feels like forever really, in relation to inflation, what that rate will be, the cost of living crisis, how people afford their groceries, their petrol, or to pay their bills and the like. So we know this is the context with which the government has made these budget decisions. We know we've got a surplus, so that means there is more yet that can be done, and we wait to see what the government does with that. So whether it chooses to spend it in the next year or so, or in the next budget, or holds on to that, wait and see. We also noted in the budget papers that there's more than $1 billion that's been identified as decisions that have been taken but are not yet public. So there is more. There is more, whether it's in the health budget, I can't tell you, but there is more that is yet to come. So we look forward to seeing what that is, and we hope that some of that will help improve health equity in Australia. So it was clear to us at CHF in watching the Treasurer's speech, as many of the team did in the office last night, that the government understands the impact of the continuing cost of living crisis for all Australians. For us here at CHF, we've been hearing for a long time that people can't afford their healthcare, and this is really contributing to how well they are. We've been working through a lot of the detail this morning and last night too with the budget, and we're starting to get the picture that there's been progress in some areas in health, but not as much as we might have liked to see in other areas. So let's have a look now at, well, what does that actually mean? There are these 4 key areas here, and what these show us is that last night's budget does take some promising steps in funding areas vital to health consumers, like expanding clinical services and initiatives such as the urgent care centres and the mental health work. However, it's really clear that not all the needs of consumers have been fully addressed. We're still waiting for something on dental, and I know, Leonie, if you're listening today, you'll be saying, yes, what happened to dental? GPs, better access to GP, allied health also. We also recognise that some of the reforms that were announced last year and funded last year have not been implemented either in part or in full, and they're still rolling out. So we haven't really seen the full benefit of what the government announced last year. So we wait for that too. And of course, we'll continue to advocate that any changes in health are led by consumers and are evidence-based, so that we make sure that taxpayers' money is spent as well as we possibly can. And while we appreciate the focus on clinical services, we're also really aware of what's missing. So there's a big gap in prevention, health literacy, and broader public health measures, which are crucial for long-term well-being. And it's challenging to discern the comprehensive vision of the government, given the nature of some of these budget decisions. So as we're digesting these details, I want to go through some of these measures a little more and talk about them and what our stakeholders might have said about them in particular. So this 8.5 billion that you can see at the screen here, while there is improved access through some of those strengthening Medicare packages, as I said, some of the work that sits under the Medicare, strengthening Medicare banner is not yet fully implemented or has not been evaluated. Also important to make a comment about the National Health Reform Agreement, which the Health Minister mentioned this morning and is mentioned in some of his releases. The government has committed to increasing funding for public hospitals through this agreement, but the agreement's not finalised yet. So that's a really important piece of the puzzle that's missing right now. And we're looking forward to seeing what that agreement looks like and how it maybe changes the funding that's available and the journeys that people have through primary care to tertiary care and then hopefully home again. So lots of stakeholders in health. I think it's one of the areas in government maybe has the most. We've been keenly looking at what our colleagues in other health peaks have been saying about the budget, and we've got some of their comments here that we'll scroll through for you. I think it's a really mixed bag. So what we see is that there's broad support for some things, like the freeze for the PBS, but other things are quite diverse views. For example, the funding into mental health, some of the mental health peaks are very supportive of, but others actually think that it's a wrong step. Some people are pleased with the work that's being done in aged care, and others say that there's not enough detail and there's not enough money. So there are definitely, the government is getting very strong and mixed messages from stakeholders. The clinical peaks, particularly the medical clinical peaks, have generally not been very supportive of the budget. The nursing peaks have been quite supportive of the budget. And you almost have to go stakeholder by stakeholder through all of this to really see how the broader community and the broader stakeholder group has viewed the budget last night. And we know for them and for us too, there's a lot of information. I mean, you go in there and there's a pile like this of books for you to read, right? It's not a small amount of information. So what we share with you today, and indeed their thoughts are all of us, they're our first thoughts. I guarantee there's something really important in that budget that we haven't noticed or they haven't noticed. Or sometimes the combination of several measures, either inside health or either some inside health and some in another portfolio, that are going to make a difference or perhaps cause a problem that we've yet to unravel. So I would just say that disclaimer for us and also for our colleagues. These are our first thoughts. We're getting them out quickly, as they are too, and they may change over time as the programs are implemented, as we better understand what these large sums of money are meant to do. So budget highlights. It's always nice to talk about highlights. So there are a few of those for us. So I mentioned the urgent care centres. Some of you will have one of these close to where you live, one of these clinics. When these first rolled out, we got a lot of positive feedback from consumers who went there. There was no queue. They got seen. It didn't cost anything. They came home. They just thought it was terrific. Didn't have to go to the emergency department. But increasingly what we're hearing from those well-established clinics is that's changed. So now you need to book an appointment. You can't walk in. Or the clinic is full and early in the day they say we can't see more patients today, go to your ED. We hear sometimes too from the clinical peaks, again, particularly the medical clinical peaks, GPs have people turning up saying, I went to an urgent care centre and the GP say, well, they didn't send me any information. I don't know what they've done. I don't know what results you've got and I can't really help you. So great idea. It's always in the implementation. And so in these new ones, we're hoping that some of the bugs that are starting to be seen in the existing clinics will be taken into account in the rollout of these new clinics too. I mentioned the National Health Reform Agreement. So the government has indicated it's putting some more money into hospitals, but we think there's more yet to come. And these services are particularly around keeping people in their community as much as possible. So particularly transitioning, so helping people if they do end up in hospital for some reason, be supported to leave hospital sooner rather than later. In a sense, these two measures are on the way in. Let's try and stop you going to a hospital if you don't need to through going to an urgent care centre. And there are some other measures like the funding for Health Direct that might also help you not need to go to a hospital. And then, of course, if you're in hospital, once you're there, if you're anything like me, you can't wait to get home. So then how do we make sure that everyone is able to get home quickly? And in the case where they need transition from hospital to home, that's funded appropriately. So we think these are good things, but always there's always a bit of caution because the devil sometimes, as they say, is in the detail. Mental health services, you'll see that's got our stamp there because this was something that was in our submission asking for community-based mental health support. So this big investment for the government there. We hope will really help with that. We do note, as some others have noted, that the Mental Health Commission, the National Mental Health Commission, has been defunded in this budget and it returns to the department. The minister's indicated that this is only a short-term thing, that the National Mental Health Commission version 2 will be developed in co-design with key stakeholders, and we're really keen to understand that and be a part of that if we can, to make sure there is an independent voice that is providing both government and the sector with information about what is happening in mental health and making sure that the needs of the community are being met. So we wait to see what happens there. Cheaper medicines, again, you'll see our tick of approval there. This is something we've campaigned very strongly for over a long period of time, particularly over the last few years. So when inflation's running high and your PBS medicines, they're those ones when you go to the pharmacy, you might pay as a healthcare card $7 something, or just over $30 if you don't have a healthcare card. They go up every year, and of course, if inflation is running high, those costs go up too. So we're pleased to see the government has paused that indexation. So that means those medicines, whether they're costing you the $7.70 or the $31.50, I think it is, they'll stay the same for a year if you're not a healthcare card holder, and for 5 years if you are. So that'll keep those medicines static. Other medicines might go up, of course, but those ones should stay still. And we hope that will help people meet the needs that they have and make them able to afford their medicines. There's also some money included particularly for clinical trials here that might be helpful in terms of getting medicines more available. There is some new medicines gone on through our Pharmaceutical Benefits Advisory Committee, so new medicines now that you can get through the Pharmaceutical Benefits Scheme, which is fantastic as well. And a few more other bits and pieces in the budget that will help make your medicines more affordable. So we're really pleased to see all of that. We've kind of put the things that might sit under prevention, all under this banner of a fit and healthy Australia. Sounds pretty good, especially as the government has mentioned a number of times, you know, Brisbane 2032, need to be fit and healthy for that. So what you can see when you look at prevention is there has been an investment in prevention, particularly in screening and vaccination. There's a lot of money gone into various things for skin cancer, for bowel screening, and for a range of different vaccinations. That's really important. So that's really great to see. However, what's missing is what I might call prevention through empowerment. So health promotion, health literacy, self-care, social prescribing, all those kinds of things we talk about where consumers can take control of their own health and make sure they've got the information, or their carers and loved ones have the information to make sure that they stay as well as they possibly can. So we definitely see that there's been a trend towards some of those more easily immeasurable, if you like to call them that, prevention strategies, but less so investing in those important preventive strategies that we are always kind of talking about. So we hope to see more of that in the future, but any investment in prevention is good because prevention is better than cure, as we all know. There's some money gone into aged care. Some of this is not so relevant to health, but we noticed the Department of Health and Aged Care, so we mention that. And of course, older people are sometimes living in homes that are in an aged care environment, and their health needs are not always well met. So this transition program, which is also similar to the work I talked about earlier in relation to the hospitals, redesigning and improving this transition program, allowing people who are in aged care who end up in hospital to transition back to their home in aged care as soon as possible. It's really important. The home care packages, again, keeping people at home, and often that is a really important part of wellbeing and health, to be able to stay at home rather than going to aged care. There is a lot of funding for various different dementia programs, and dementia burden increasing, of course, with our population aging. So we'll expect to see more of that in the future too. So some important decisions made around aged care. So we've had a little look now at the budget and cut it, thinking about different groups and how they might have been feeling post the budget. So the first group I'll mention here is the First Nations group. You can see some key measures here on the screen. I would also mention that the Closing the Gap PBS payment co-payment has been removed. So that means that People will be getting their medicines free, or for the $7.70, the healthcare card amount. So up until now, there was a list of medicines, and if you were registered through Closing the Gap, there was a list of medicines that you didn't have to have a co-payment for. Now that's been removed, so every medicine is available. So that, again, if we go back to that medicines affordability, and when we talk to consumers, often their medicines are just as important as being able to access care. So anything that allows people to afford their medicines, we hope will help keep them well. So there are some things there for First Nations folks. And we also looked at rural and remote, noticing that, of course, not all, but certainly a significant proportion, particularly in the top end of First Nations people, live in remote and rural communities. There's some funding here for the flying doctor, and also some funding for other health workforce. So money for AIDA, the Australian Indigenous Doctors, and others to improve the ability of people to access healthcare, because there are doctors and other health professionals living and working in local communities, which is terrific. Generally, though, there's not a lot here for the rural and remote communities, and we would really like to see better access. We know that the equity, when we talk about health equity, equity of access to people who are living in remote and rural communities is a really big deal. We don't do well enough here. I don't think this budget takes us to where we need to be, but it does provide some movement forward. A health workforce, some of you will know that we've got a scope of practice review on at the moment. So we're looking at how to use our health workforce. And we suspect that that's why there's not a big impetus in this budget talking about health workforce. While there are some important initiatives, we suspect the rest of them are waiting for the end of this review, and post that review, the government will announce how it's going to better support Australians through providing better access to a range of different health professionals. So you can't see much in this budget on scope of practice. There's a little in allowing some disciplines like midwives access Medicare item numbers that they couldn't previously, and so on. So there is a little, but there's not a great deal. And I think for us, if I go back to what I talked about in relation to prevention and empowerment, some of it is us all as lay people who look after our own health. What can we do to keep ourselves well, to take the work away from health professionals when we don't need a clinical opinion, we just need some information. So the more we can do in that regard, the better. And we know that the Commonwealth placement payment, so you might have seen a bit about that in the news, saying that we'll pay some of our students while they're on placements to help them be able to afford to have a placement, is great. But we know, again, people in remote and rural areas, particularly if they've had to travel to somewhere a long way from home to live to do a placement, that's really tough. And we'd like to see more of that, to make sure that we have more people from rural communities able to be able to afford to actually be trained as a health professional, and ideally return back home and look after the community. So women's health was a big part of the budget, and Minister Carney with the National Women's Health Advisory Council has been working very hard to get women's health on the agenda. And again, there's a long list of things that are being done to improve the health of women. Primarily here, it's around reproductive health. There are in some other parts of the budget measures that talk about gender and violence, and some work that the government intends to do there. In the health budget, it's more around reproductive health. So the women's health package supports help for women's services, particularly in relation to miscarriages, stillbirths, preterm births, early pregnancy, menopause, contraception. So as I said, a lot around reproduction. There's also a new drug listed on the PBS for a particular type of early breast cancer. So really good results for women's health there. And there are some initiatives in other portfolios we thought are worth mentioning. So we will pay the Medicare levy. The low income threshold has been increased for this. What that means is that before the budget, if you earned under, I think it was about $38,000, you didn't pay that levy. Once you were over $38,000, you did. I think they've lifted it to about $41,000. So that means that there'll be less people paying that levy. That's important. All of these little things, I think one of the criticisms of the budget is some of the decisions haven't been big enough, but all these little things will add up. And I think we'd say we would have liked more, but still it's good to get something. And for some people in the community, these things will really make a difference. There is also a bit of a note talking about how Services Australia will improve its customer service, which I'm sure we'd all agree would be wonderful to see. There's some initiatives around digital health as well, both to improve my health record and also, as we mentioned earlier, with mental health, to improve that low intensity mental health service. So we're really keen to see how that looks. That was one of our asks: better free access to mental health services for those experiencing things that are frequently experienced, like people having mild anxiety or perhaps having some other stressors in their life where they really need some counselling and support. There is a bit of money in the budget for artificial intelligence outside of health. And we mention this because we know that health will be impacted by the decisions that government makes about the use of AI in industries. And so we're keen to keep a bit of an eye on that because we know that over time that will impact on our health care. Now, of course, I said we'd have the highlights and then we'd have the lowlights. So here we are with the lowlights. As I've kind of gently alluded to, we really are strong supporters of raising the rate for job seeker and for income support more broadly. We believe that's one thing that will keep people well, will reduce their anxiety, not being able to pay their bills, and be able to do the things they need to do to keep themselves well. So there's a little assistance, rental assistance improvement, and there are some other measures that might help a little, but we think not enough. And we would love to have seen more here, but we are hopeful that something will come into the future. We campaigned pretty hard for some changes to be made to the PBS safety net. Particularly what we wanted was for that safety net to become automatic. So rather than you having to do a whole lot of homework to discover if you'd hit that net and can get your medicines cheaper, we want the government to send you a text message, an email, a letter, a carrier pigeon, I don't think I really mind, to say, you know what, your medicines are cheaper now. That didn't happen now. We'll keep pushing for that, and we hope that it happens soon. I mentioned earlier preventative health. The National Preventative Health Strategy and some other key strategies are still not funded. The government did commit to a wellbeing budget that seems to have disappeared. The goal of reaching 5% of the health budget going towards prevention, not yet met. And as I said, when we look at that prevention, there really is a lot that is that screening, immunisation kind of prevention, not that let's teach you about how to better manage your diabetes, or these are things that you can do to keep active so that, you know, it helps with your arthritis. So we want to see, of course, both, but at the moment, not enough. Dental, we're all really sad about dental. I don't know if I'm surprised, but I am sad. This is a glaring issue for Australians not being able to afford dental care. Last year, Australians took hundreds of millions of dollars out of the superannuation to pay for dental care, those that could, and many people simply are living unable to eat and in pain and feeling shame because of their current situation. So that needs urgent addressing, and we'll continue to advocate with the National Oral Health Alliance for better access to dental care. There are these key strategies that have been put in place, but there's no funding yet to do anything with them. They also relate broadly to prevention. And the Centre for Disease Control, which 2 years ago was, ta-da, look, we've got one. Nothing in the budget and no really talk about what that means. There is a little work going on in that vaccine preventable disease, which is certainly a part of the work that the CDC would do. But the non-vaccine preventable, the non-communicable diseases, issues like climate change, preparation for disasters, bushfires, pandemics, whatever, we're not really seeing anything visible much come from the CDC, and we would have expected an investment in the budget here, and it's not been there. So we wait to see what's happening there. So where to from here? Well, I suppose for each of us personally, the question is, well, what in this budget might help me be healthy? What can help with my well-being? You can look at this video. We'll show in a moment. There are places you can go online to find out more information about the budget. Keep in mind that it's in the budget papers. The Parliament hasn't approved it. And then after that, the money has to get out to those services. So you don't expect it's in the budget today and tomorrow you'll be able to access a service, but really good to think about, well, what's there and what I should be keeping an eye out for. And maybe over time, talk to whoever it is that you, whoever supports you with your healthcare, and ask them, has anything happened? What can I do? Maybe some of your medicines are cheaper. Maybe there's something else that's going to be shortly there for you. For CHF, we want to continue to work with consumers find out what the issues are they want addressed and make sure that we get them to everyone who will listen, and even some that perhaps don't want to make sure they know what ordinary Australians want from their healthcare system, and indeed from their out-of-pocket costs, from their tax. We're paying for it, so we should have a right to say what there is there. We'll be looking at our budget submission, identifying the areas where we've already got a tick. That's fantastic. Crossing a line through those, looking at the others, and then going back to community and of course to you as our members and saying, okay, what's missing? What did you think? What are we going to put in for next year's budget? So that's next for us. I would encourage you to keep putting your questions in the chat. I can see there's 5 at the moment in the Q&A. Keep putting them in because in a moment we're going to go to questions. Now is your chance to ask questions. So pop them in. If you put a question in the chat, it'd be great if you can just cut and paste that into the Q&A so we can see them all in the one spot. Okay, so if you want more information, go to budget.gov.au. There are lots of fact sheets. They can be really handy because they summarise particular issues. You can also go to health.gov.au and there are budget links there and lots of stakeholder packs. So for if you're representing an organisation, you've got members that want to know more about the budget, this is a really easy way for you to go see what's going on and, you know, provide links or share the content with your members. So I encourage you to go there. I also encourage you to stay in touch with us on a range of different platforms. Do join with us, share what you know, and keep in touch with the different things that we are doing. One of the things we've got coming up next week is we've got the Minister himself here for a webinar. So we'd love to see lots of people there. If there's anything from what I've said today or anything from what you've seen in the media commentary yesterday or today or tomorrow that talks about your wanting to know more, this is your opportunity to ask the Minister a question. You don't get these very often. So we encourage you to register. Tell your friends to register. Register the people in your street. Get you all come along with your questions. When you register, we ask you, do you have a question? Put it down and be prepared to have your question read out to the Minister on the day. We're hoping to have lots of time and ask him lots of questions. He's done these presentations with us in the past. He's normally very open, answers all the questions. We tell him we're going to ask them all. And he's open to answering any questions that you have. So register and come along with your questions. So we're going to move to your questions now. So we've got a few in the chat. So we'll have a look at these and, oh, sorry, in the Q&A rather, and see how we go. Okay. I'm not going to do this in any particular order. Hi, Claire, I can see you've got quite a few questions here. Can't see anything in relation to social prescribing in the budget, but it's sometimes hard because there are measures that say things like we'll be supporting people with chronic disease, but it doesn't say anything else. So that could also include an element of things like social prescribing. We can't tell right now. So you definitely need to think about keeping your eye out for what comes in the next 6 months. And nothing generally about building the capacity of consumers more broadly in any area, not only in digital health. And that's one of the things we asked for in our budget submission for the government to fund consumers to be able to better advocate on their own behalf in the healthcare setting, and also to be able to better provide information about to various community groups or indeed on government's stake, task forces and the like. None of that in the budget to date. Yes, so Susanna, you're asking about the Medicare safety net. So you do get notified when you've met the threshold for the NBS safety net, but as you pointed out, not when you're getting close. So these are the kind of things we think the government should be able to do. It actually has the information. It knows how much NBS you've spent. It knows how much of the PBS you've used. It should be able to tell you. Imagine being able to just go onto your My Health record. I was never going to say MyGov, but some people would, probably not be happy to hear me talking too much about MyGov, but be able to go somewhere and see, actually, where are you? Are you nearly at the end of having to spend? Are things about to get cheaper for you? Because sometimes you're making a decision not to go somewhere to get your medicine, to go for an appointment, not understanding that it will be cheaper. So we think that all of that stuff's really important, Susanna. And we'll keep advocating for those kinds of things. When the government has that information, we expect that it should provide the information, be considering actually acting on that. Penelope, you've asked about how Medicare, strength in Medicare is supported or not in the budget. Well, there is some more information for some of those initiatives. So things like the urgent care centres, they're considered part of the Strengthening Medicare banner that work in helping people transition in and out of hospital, so back into primary care more quickly. That's also part of the Strengthening Medicare piece. So there are certainly things that talk about Medicare in kind of fine detail, like particular new item numbers, reviews of how the Medicare system's working itself. That's also included in there. But there are other pieces that you saw earlier on in the presentation where the government says, these are the broad things we're trying to do in strengthening Medicare, and we've now put a bit more money towards them. So there is a bit more in that space, but there's so much to do. And I think we would recognise, as the government has, is that there's a long way to go before we get to ideal. And I think we saw last year and this year again, the government saying they know not only in strengthening Medicare, but in other areas like housing, where we've disinvested for a number of years. Can't fix it overnight, even though everyone wants to. So I think tempering our enthusiasm to want to fix things right now with the realities that governments can't fix it all right now. And if we want them to be evidence-based, we want them to be co-designed, we want them to be community-led, we can't ask them to do it all at once, because those things don't go together. So how do we make sure that we get good care, and that the care is also evidence-based, and that the money that's spent is really well spent? Margaret, you've asked a question about moving older people from hospital and the issue about ACAT. Yeah, so this is one of the things that sometimes stops people from being able to get access to aged care if they're in hospital, and then it possibly looks like they might need to move into aged care, but we can't get an assessment, so they can't go into aged care. Even if there's a bed available, they can't go there. We're hoping that some of the funding that they've earmarked in the budget for transitions, either under aged care or also in the strengthening Medicare area under hospital funding, will take that into consideration and help provide better support and better pathways for people who need an aged care assessment in order to be able to move into aged care and be better supported, because they've now become too frail, for example, to live at home. Again, I'd say you can't see this in the budget papers, and that's part of the problem. So it's really easy to be critical and say, oh, they haven't done this, but actually it might be in the fine print that we can't yet see. It may be in the more detailed documents that the department holds. So we wait to see. But I agree, we really do need to get people out of hospital and then into wherever it is they need to go next, whether that is aged care or home, as quickly as they possibly can. So everything that we can do to do that is obviously a good thing. Just having a look at what other questions we've got. Claire, you've asked a couple of questions about the kind of national health, or at least one about the National Health Reform Agreement. So, I mean, this is an agreement between the jurisdictions and the Commonwealth Government. And traditionally, that it's a behind closed doors conversation between governments, and communities are not part of that conversation. We think they should be. We think a couple of things. We think that actually communities, whether it's consumer peaks or other mechanisms, should be included in helping set the priorities for the billions of dollars that get spent here. So that's the first thing we would say, absolutely. I think the other thing that we'd really like to see is some kind of way of us measuring how well this money was spent. So we put billions of dollars in, and really the reform agreement is largely a funding instrument. Even if you've seen it, it's 100 pages long with a whole lot of funding formulas. What you can't see is how well it worked. There aren't any prems and proms that would talk about how people's experiences were. There's not even information about how long people have been waiting and how quickly they got the care they needed that was essential, all those kinds of things, which a consumer lens would, ask for. So we would love to see that consumers had more of a say in all kinds of areas in relation to the National Health Reform Agreement. But the reality is this is a government-to-government agreement. I know that we've spoken to them. I know that most of the jurisdictional peaks also, when they had the opportunity, as you did, said to state and federal governments, we really think consumers should have a say here. But this is, a small piece of a larger game that we call federalism. And so I don't know what our chances are in the long run. Maybe we'll have a chance, but in the short term, perhaps nothing much will change. We've got some other questions here. I'm just looking through the list to see which ones are answered and not answered. Cleve asked a question about a pre-election budget. Well, I don't know that there'll be a pre-election budget. Depends on when the election is called. So perhaps there will be. In which case some of the things we're talking about today might be covered off in that pre-election budget, or there might be a very generous mid-year economic forecast. You know, that MyEFO that comes towards the end of the year, sometimes they also do a pre-election forecast, and with that, they make some spending announcements. So that could happen. Really depends, I think, on the next 6 months and how things go politically. So I don't think we can know that there'll be any more good news, whether the government will feel it needs to make itself a bigger target by declaring more policy positions, or decide to stay where it is and hope that that will be enough to get them over the line, and whether they think they have a chance of staying in government independently, whether they think they're going to need the support of independents. All of this will play into what they decide to announce or not announce between now and an election. So we need to wait, I think, just wait and see what comes out of all of that. Just looking to see if there are any other questions. One of the things, just while I'm talking about the election, one of the things that CHF does as well is have a process around our budget submission. We also have a process around what we put out to all parties in relation to elections. We don't have a campaign or a platform. We're not a political organisation, but we will say to everyone who's interested that this is what it is that we know that Australians are wanting to see in health. And so we hope that all of the major parties and the independents look at that and include some of these things in their own election platforms. And they say, if elected, we agree with CHF and we will help make sure that the Medicare and the PBS safety nets are automated. Yes, we've heard from CHF saying we need more prevention that empowers community, and if we're elected, we'll do that. So the idea is, I suppose, to give them your good ideas and hope that they're reflected in the policy positions that politicians take. And we will be going around to our members, as we did with our submission, and asking you all, well, what is it that you want to see? How do you want to see this done? Now, I just want to check if there are any questions in the chat that didn't manage to get into the Q&A. So I know we're getting close to the end of our time. So I'd encourage you, if you've got a question, to pop it into the Q&A so that we can answer them. Most of the ones that are in the Q&A, I think I've answered. I'm going to have a quick look in the chat to see if there are any in the chat where people have asked a question there, but it isn't covered off in the questions that were in the chat. Okay. Angela asked if we've seen any calculations about the savings with the PBS. No, and I think it looks difficult to do because it obviously depends on which medicine someone's taking. And remember that what the government's saying is not reducing the co-payments, it's saying they won't go up. So with the government, you'll probably hear the government say your medicines are cheaper, or we would probably say they're just not going up. And then we'd probably add another caveat, that's only your PBS medicines. If you pay $50 for some medicine because it's brand spanking new, that could well go up. If you're paying some $15 for a statin or one of those medicines that's under the $30, that could go up too. So we need to be careful about saying what it is that the benefit is. We do think for some people who've got a lot of medicines that they currently get under the PBS, this will mean over the next few years that will stay still. And if inflation does remain high, that will be a really big help. And of course, it depends how high inflation is. So the higher the inflation, the more relevant this will be. Marcelo just asked about the presentation being available. So for all of our members, we will send out a link to this presentation. Okay. Oh, thanks. And one of my colleagues has answered that question. So fantastic. I'm just checking through, just bear with me as I have a look through the questions. I'm just going to check the questions in the Q&A again to see what else might be in there. Yes, so Angela, thanks for putting your question in both places. Now I've answered it both from it being in the chat and from it being in the Q&A. So thank you for doing that. That does really help me when they're all on the one spot, because often the chat gets very busy and it's sometimes hard to see the questions that people want answered. We've still got time for a few more questions, so put them, by all means, put them in. Claire asked about collective advocacy. For us, that's going out to our members, asking them what their views are and then representing those. I think the challenge for collective advocacy, and we sometimes do that in different formats, is whether everyone has the resources to do the collective advocacy, because so many of us run so close to the bone. So can you come to 10 meetings? Do you have someone that can put this information on your website? Can you run a focus group and find out what your local folks want to do? I think we all love to do more of that. But it's a question of how do we fund it? How do we resource it? So those opportunities are always welcome where we can support them. Susanna, you've got a question about prior election commitments. So these are things that are not implemented. So what happens to prior election commitments that are adopted into the budget but not implemented? So some things are mentioned in budgets, but then they don't happen. So yes, sometimes they do happen, but they happen late, and sometimes they never happen. Depends on how they have been written into the budget papers, if they've been written in fairly broad terms, and you might have had a local member who understands that it means something and says to a local community, the government's going to invest, I'm just going to make this up, in $2 million for chronic disease in our area. And you think that's fantastic. That's going to mean all these things for us. And the local member starts talking about, we're going to build a community health service, and we're going to do this, we're going to do that. But actually in the budget paper, it's pretty broad, just says chronic disease. And then, of course, it doesn't happen. So sometimes the way people interpret the election commitments and what goes into the budget are not the same. This is very difficult for consumers to understand, of course, if they've been told one thing and it doesn't happen. Other times governments just don't do what they say they're going to do. So our pre-election commitment is not the same as some things in a budget. I mean, before an election, all the parties will say what they're going to do when they get into government. Only once they get into government, they're able to take those commitments to the Parliament and say, this is what we'd like to do. Will the Parliament support it? I mean, even this budget right now, it's a budget. The papers have been given to Parliament, but the budget hasn't been passed. It's possible that the crossbenchers or some other folks, the Teals and the coalition in the lower house, will get together and say, we want 5 changes to the budget before we approve it. So we see the budget last night and today, and we go, oh, this is what's happening. This is not necessarily the same as what's passed in the bill. And then, as you've noticed in the presentation so far, some of what's in the budget papers is pretty loose. Sometimes that's because the government hasn't decided exactly what it's going to do with that money, but it broadly knows it wants to put it in a particular place, helping young people, looking after people who have cancer. And so then you have to wait and see how that actually gets pushed out in policy through the health department. From our perspective, we just keep pushing for anything new you're doing, how you're involving consumers, how you're making sure consumers are involved in the evaluation of that work. All that's really important for us as well. So Marcella, you're just commenting on that there is money left. Yes, so we've got a surplus. We've also got this money that has been decided but not publicly, it's not been publicly said what's happening. And I do think that is really challenging for all of us, that we know people or ourselves that we might need better access to healthcare. And we can see a government's got money, but it's not choosing to spend it. And I can understand your comment about people left suffering. I think we all feel that. Angela, there's no suggestion in the budget that stage 3 of the 60-day dispensing will be brought forward. We did ask for that in our budget submission. We will probably ask again, but it's not in the budget. And we were saying to start it in July. That's only a little way away. So my guess is it won't happen, but we could be surprised. Thanks for your clarification there too. That's really helpful. Thanks, Claire. I think you've gone now though. Irene's raised an issue around drug and alcohol services. It's an area very close to my heart, an area I'm very passionate about, so thank you for raising that. We see a lot in the budget for mental health and only really 1 or 2 line items for drug and alcohol. I find this quite, concerning because there are lots of people who are experiencing substance use disorders that could afford better support. We don't always do that well. And it would be great to see a bigger investment. I think what we find more broadly is that areas in health that you might consider can be stigmatised in some way, sometimes get less funding. We were only talking about that today as a team. So we look at the things that you might have as a health condition that, the words I was using is it's kind of like the favourites, and then there's the forgotten. So which are the favoured health conditions, which are the favoured groups that often tend to get more funding in budgets? And then which are the groups that are forgotten? And I think, Irene, people with substance use disorder are one of the groups that are often forgotten. And they're forgotten year after year. So things just go backwards. And I think my view, and I believe also CHF's view, is that we think it's fantastic that some groups are favoured because we want everyone to get good healthcare. We don't have a problem with that. We just want everyone to be favoured. And so how do we better make sure that communities are able to get the care they need, regardless of the discrimination that they might face, either as individuals or as communities? And I think as an organisation that values health equity, we'll continue to talk about this. And what we hear from our government is that ideologically that they would agree with this. When we hear the Prime Minister, the Health Minister speak, they often talk about these things being incredibly important. I think what's a little challenging is in this budget, it's a bit hard to see some of that. So we might say we really think these are important, but whether or not it actually gets funded is a whole another matter. Marcella's asked about family violence. There are a number of things for family violence. A lot of these, Marcella, were the things that were mentioned and agreed by National Cabinet a few weeks back. Most of them are not in the health budget. They're in other budgets, but there definitely is. If you went online to the budget papers, and then I don't know if you know how to do a find or a search on a website. If you normally in your browser, it'll give you an option. If you look at the menu to find things, you put in words like gendered violence or violence and search, you'll find all the times it's mentioned. So there is definitely money in there, but not so much in the health area. The women's health stuff, as I mentioned, is more about reproductive health. Now, Susanna's got another question too. Right. Yeah. Okay. I got you now. So it depends is the answer. Sometimes if the government says it's going to do something and then that doesn't happen, the money goes back into what I call consolidated revenue, which is really Treasury and Finance. So we see this also with, I don't know, let's imagine CHF was funded to do a piece of work for $20 million in my dreams, and we only end up doing half of it for whatever reason. We would have to give that money back to the government, so we only did half. And then the health department usually have to give that back to Treasury, and it goes into the big pool. And then next budget, it gets spat out, and it might go to defence, or it might go to infrastructure. There's no guarantee if it's not spent and then it's taken back into the general revenue for the country, that it will, in the next budget, go back in the same way. Sometimes that happens, but the process normally is unspent monies going to the central pool, and then governments have this process where they have an expenditure review committee, as you know, that then looks from the very beginning each year about what we're going to spend in a budget. So if this project you're talking about in Western Australia that didn't happen and doesn't seem to be here, that may never happen, because the money, if it wasn't spent for whatever reason, may well have gone back into consolidated revenue. If the health department put in another bid for that, it may or may not have been successful this year, because last year it was successful in the expenditure review process leading up to the budget. Doesn't mean it'll be successful this year. So sometimes the health department might have even put that in, but it didn't get up, versus maybe they decided it was no longer a priority. Okay, I think we've answered most of your questions, folks. Oh, Mitch has asked about LGBTIQA+. There's money for HIV, AIDS, and particularly the minister today said that his intention is to try and eradicate HIV/AIDS in Australia. He wants us to be the first country in the world to do it. And so they've put money towards PrEP and other things, community engagement and resource building and so on, in the hope that we can make that happen. So there's definitely funding there. There is a national plan for improving the health and wellbeing of the rainbow community, and I think this was part of that plan. There may be some other things too. There's a little bit in men's health, men's sheds and some other things there, but not for all of the community. We were reflecting on this. So, for example, nothing for people who are transitioning or have body dysmorphia. We didn't see anything like that. So again, a bit of a mixed bag. Yes, there's a little bit, but not everything is there. I'm just going to look because it's just about out of time, folks, and to see if there's any other questions in the chat that I haven't covered off on. Yeah, it's really tricky because Susanna's just asking about, what about when we need state and federal to come together? Thank you, federalism. Maybe one group will come to the party and the other won't. I think that's really tricky. That happens everywhere. I don't know what the easy solution is, but part of it is just being active. Come to our webinar, talk to other people, join, your peak body or other organisations and form together a community, write a letter to your local MPs, all the usual stuff. I think there are lots of benefits in federalism, but sometimes it's hard work too. And so we just have to, I suppose, take the good with the bad. So I think we're just about out of time, folks. I'd like to thank everybody for joining us today and for your really terrific questions. Thank you. We'll keep these all in mind next time we're talking to the Department and the Minister's Office and share some of your thoughts with them. It's always very helpful. As I said earlier on, we have the Minister next week, much more exciting than me. So I really encourage you, if you can, next Friday to join us. The link is there in our webinar. It's also on our website. We've had it on our LinkedIn page. It's been everywhere. So if you can join us, bring your questions so that you're ready to ask them to the Minister, and encourage everyone you know to come along, because having a Minister there to answer your questions is a rare opportunity. And I'd just like to finish also by, again, just thanking a terrific team here at CHF. Couldn't have better people to work with. Done a mountain of work, working late last night and early this morning to get this presentation to you so quickly. But we know that you're keen to hear what the issues are. And we'll continue to have this conversation. So if you're following us on LinkedIn and our webpage and Facebook and so on, you're going to find over the next week or two, we're going to keep talking more about the budget as we have a look at it more carefully, get more depth and understanding. So if you want to know more, stay connected with us. Otherwise, we thank you very much for joining us, and we hope you have a great week. And we look forward to seeing most of you, if not all of you, next Friday for our webinar with the Minister. Thank you, folks.